Alrighty, everybody, hold on just a minute as I go live on Facebook.
Naba.
Mm.
Naba.
Okay,
Here for you.
thank you.
Boing, boing, boing. I need to go potty.
Okay, go.
Mommy. Please, please. Mom,
Alrighty, we are live. Welcome, everybody. Happy Thursday night live. So good to see y'all. I cannot wait for tonight's live. Thanks, everybody, for being here. Please invite your friends. Share this with your colleagues as we work together to bring airway to everybody. Let's go ahead and introduce our speaker. Tonight we have Dr. Doug Thompson. Dr. Thompson began his dental journey at just 18, starting as a lab technician. After earning his degree from the University of Michigan School of Dentistry in 1996 and completing a hospital-based residency in 1997, he purchased a thriving practice in Bloomfield Hills, Michigan, now known as Integrative Oral Medicine. Dedicated to advancing his expertise, Dr. Thompson has pursued extensive continuing education at the prestigious Coy Center in Seattle, specializing in personalized periodontal medicine and wellness dentistry. His commitment to education led him to teach at the Coy Center and establish a pioneering course for dental hygienists. Oh my goodness, this is so exciting. Beyond dentistry, Dr. Thompson holds a fellowship in anti-aging and regenerative medicine and has contributed to dental and cardiovascular medicine literature. In 2015, he founded the Wellness Dentistry Network, uniting like-minded professionals across the globe. Okay, Dr. Thompson is highly regarded by medical and dental industries for his insights into periodontal medicine, his collaborative approach to patient care. Passionate about educating both professionals and the public, he emphasizes the profound impact of oral health and overall well-being. Today's topic is wellness dentistry and optimal health, a life-changing opportunity. Welcome, Dr. Thompson.
Hey, Renata, thank you. That's one of the most interesting introductions I've ever had, so thanks for that. What I'd like to do is just share quite a bit of information that we're going to have tonight, so I appreciate that. I just want to share my screen and we'll get right into it. One of the things that I wanted to do is talk about wellness dentistry and really what it is and Optimum Health, and it really has changed the lives of several of my patients in practice, and it's really pretty incredible. So thank you. And, one of the things I was looking at when I talked about, or when you asked me, maybe could I present on Airway Circle, I went and looked at your, what you guys are about, because I didn't know so much about that. And it's amazing that when we think about sharing with interprofessional and interdisciplinary concepts, I really wanted to talk about whole body health, and not only how airway is related to whole body health, but how other things are related to whole body health as well. And so whole body health is an interesting concept, and maybe from the hygiene team or myofunctional therapy team or somebody who's really airway centric, how you would think about, what is it? So as you mentioned in the intro, I created something called the Wellness Dentistry Network, which is a learning platform for dentists and their teams to get into what we call wellness dentistry. So tonight I want to cover what is wellness dentistry, why is it important, what's our role in wellness dentistry, how do we implement some of the concepts, and really what's in it for me. That's a big thing because I don't want to try to add anything to any of our repertoires of things that we do if there's not something in it for us. That's the idea. So what is wellness dentistry about? It's really about a team of people that get around a concept that have really this keen awareness about how oral conditions can affect and ultimately affect systemic health. And you say, well, I know that already. I know if you don't breathe well, you're not going to be healthy. Well, it goes way beyond that. And there's a whole bunch of things that you could maybe think about. And maybe tonight we just expand the thinking a little bit and go into some areas where you, as a myofunctional therapist, dental hygienist, dentist, you have an amazing other allied health professional, You have amazing opportunity if you can just ask a few questions to guide a patient to better oral health. And what gives us the courage to do that? Like, how do we know? Well, this is a trial registry of research now, cross-reference. Let's just take periodontal disease. And you could do the same with sleep medicine. Take periodontal disease, now being cross-referenced in the literature to 57 systemic diseases. I mean, I thought it was heart disease and caries, or I thought it was heart disease and diabetes. No. 57 different systemic diseases. So what a great opportunity we have in dentistry if we just know what to say or we know what to look for. How cool could it be to help patients? And so why us? Why a dentist? Why not a medical facility office? Why not some other health professional? Why us? And the reason why is because people that come to see us more frequently, and they come to see us for longer periods of time, and we have FaceTime. So it's an amazing opportunity for us because about 20% more people see us regularly than they see other health professionals, and it's a great opportunity. So here's the paradigm we have to break, because what people think of dentists are that we just fix teeth. And we learned this in 3rd grade. What else did we learn in 3rd grade? We learned that doctors actually are people that make people better. And I've had people ask me, did you get your degree online? Was it night school program? You're really not a real doctor. That's kind of going away right now. But I can tell you, I have people in my office in Bloomfield Hills, Michigan, which is a suburb of Detroit, that work for the auto companies, high up in the auto companies. And they say, why is it that I can have a more meaningful conversation about my health with my dentist than I can with my physician? And actually, dental hygienists are even better poised because you have more time oftentimes than we do. So today, dentists can have a huge role in making people better, but it's a paradigm shift. And we have to guide and coach patients to tell them and show them what we do. That's what we have to do, because patients don't know sometimes what we do. And so that's the idea. We want to show them and teach them what we do. Now, we have 6 key areas of dentistry that all of us evaluate. We do it every time someone comes in for a hygiene exam, a hygiene appointment. There's 6 key areas, and we're always looking for gum disease, right? We're always looking for gum disease. We're always checking for cavities. We're always looking at how the teeth align, and I call that bite disease. And, we all are looking for oral abnormalities. We call that oral cancer. Now I call it oral abnormality exam. I'm looking for anything that could cause pain, disfigurement, loss of life. But it's an oral cancer, it's an oral abnormality exam. And I don't want to call it oral cancer, because if I find something and I tell them to come back in 3 weeks, they think they have cancer. So again, and then what about sleep apnea? Obviously, this is your wheelhouse, and you could teach me more about sleep apnea probably than I know. And but this is a big important area as well, because the health effects from this. And then what about environmental damage to the teeth? We call that biocorrosion. You might know it as abfraction lesions. But these have an erosive component, an abrasive component, a stress component, and they have an acidic component, and they have a biofilm component. But we group it all together, we call it biocorrosion. But what about in addition to that? I mean, we look at all these areas of medicine, and our dentistry, and we have a very controlled way of looking at these 6 key areas. And I learned that at the Coy Center in Seattle, and I'm happy to share that I'm on faculty there. We have a 2-day hygiene course. We have a 4-day wellness course. We have several courses that would be great, and I would love to have any of you there. But we learn a very detailed way using risk-based protocols of how to break the patient down into significant areas so we are thorough and we don't miss anything. But guess what? In addition to that, there's almost 17 other areas of patients' health that can be really significant for them, not just the 6 I learned in dental school or at the Coy Center. And I call these, we created a campaign to teach our patients about these things, and it's called Health Measurables That Matter. Health Measurables That Matter. And that's an important concept, because patients should know their numbers. They should know things that are metrics that allow them to track their health over time. And there's in multiple areas. And what I want to do tonight is talk about wellness dentistry and how your easy communication tools and your discussions chair side can lead a patient to even a life-saving opportunity. And I have patients that say that to me all the time. Thanks for saving my life. So what is a health measurable? What is that thing? Well, you know, it's something significant that we can measure. I mean, a health measurable is something significant that we can measure, and the measurement can be repeated so that you can find out if you could change it. And then why is it important? Why do I need to know? Because, you know, this is so true. And I'll mention this again at the end of tonight's presentation. But, you know, when you're healthy, you want a million things. But when you're sick, you just want one. You just want to be healthy. And then what's the goal? Like, why am I doing this? What's the end game? What are we trying to give our patients? We're trying to give our patients increased vitality and increased longevity. Most people, when they age, all they want to do is be social and eat a good meal. And they want to sleep well. And they want to be able to use the bathroom. That's about it. And so the idea is we can be significant in helping people get set up for that. But what does it involve? Lifestyle change. And what do we learn when we read books like Younger Next Year? We learn that basically 70% of all kinds of premature death and aging can be prevented from just interjecting some moderation in one's life and in their lifestyle. And we could eliminate all these issues if we wanted to, but it would take behavior change and lifestyle change. And I can't tell you how significant you are chairside, or you are even if you're doing work over the internet with people, to let them know that getting old and frail and feeble and senile and lack of movement is not normal. It's not part of the normal aging process. And so we just excuse it as being normal. And we say this all the time. Oh, it's just normal. It's part of getting older. No, it's not part of getting older. I knew people who looked at their cardiovascular health and they were 10 years, their vessels were 10 years older than their chronological age. And now after treatment and moderation and lifestyle change, their vessels are 30 years younger than their chronological age. So you truly can get younger next year. And when you're helping people breathe, believe me, you're making them younger. Because the day they come in to see you and they can't breathe well, they're older than they are the day before or the day after when you help them breathe better. That's the key. So what did the whole world learn in 2004? That inflammation was a secret killer. 2004, 20 years ago. And more recently, other books and information has been created about inflammation. And what's happening is medicine is redefining cardiovascular disease. I mean, this is a big deal, cardiovascular disease. And what is it? It's basically, it's an inflammatory disease of the blood vessels. What causes inflammation? And in today's 2024 language, we'd call it oxidative stress. But what causes that? What adds to it? Well, you know, it's a whole lot of different things, but in periodontal disease management, which our periodontal therapists manage, it's the bugs that live around the teeth that cause inflammation. What is it in our airway world, in our sleep apnea world, and sleep disorder breathing world? It's obviously the inflammation that's stimulated from the small bouts of suffocation that we have every night when we're not breathing properly, or we don't have the right structure, function, or behavior of the airway. That's what happens. And so we have a great opportunity. So in 2009, I started to think, maybe my practice shouldn't be called, you know, Doug Thompson Smiles. Maybe it should be something different. So we rebranded it to Integrative Oral Medicine because it was impossible for me to separate the mouth from the rest of the body when I was evaluating a patient. What I found out is when I started having these health conversations with patients, they wanted much more balance in their life. They didn't want just their teeth fixed. They wanted me and us to help them with other areas of their life where they could do it easily. I could say it in a way that was easy for them to understand, and I could give them some practical tips and hints that would make it doable. That's what wellness dentistry is all about. And it starts with you, and it starts with understanding the prevalence of disease that's sitting in our chairs. About 50 to 65% of people have periodontal disease. I don't know what the stats are on sleep apnea, but it's a lot. You know that better than I do. And I can tell you that a healthy mouth is the key and is the gateway to a healthy body. And we have research that's telling us that every day. As a matter of fact, if you go back to the 57 different things that I talked about, diseases, a new paper's coming out on that every single 20 minutes. And so it's a lot. A couple papers will come out just during the time I'm sharing this message with you. And what are we looking at when we look at heart disease, which is a big killer? And it's a big killer of women, by the way. I can tell you, for the gals in my life that work with me, you know, men are wimps. We get sick and we have to take a day off and we have a big problem. No, women don't do that. They're like, I got to get the kids to school. I got to make lunch. I got to do this. I got to do that. I got to get to work on time. And guess what happens? Many of you push through it, and 64% of women die suddenly. That die suddenly. The first time they find out they have heart disease is when they have a heart attack and stroke or stroke. Men, it's about 50%. So again, what are we thinking about, and what does the inflammation do to our bodies? It inflames our arteries, and it changes the biology of our blood vessel to an extent that we can measure it. And I can tell you, if you're a physician and you're trying to put out arterial inflammation, which causes heart attacks and strokes, you can't do it without a thorough dental evaluation. We have to be able to evaluate perio, caries, biofilm-mediated infections, which would be perio and caries, and sleep apnea, and other acid erosion issues and other issues in the mouth that can cause significant serious health implications. Why is that important? It's important because every 34 seconds, 40 seconds, someone's dying of a heart attack or a stroke. We lose about 60,000 people every month to heart attack and stroke death. And we have a significant role in that. As a matter of fact, as a dentist, if I can screen for some of these things that are causing the likelihood for a patient to have heart attack and stroke, it's critically important. I mean, we could save billions of dollars in healthcare costs. And we have 27 million people in the world that visit a dentist every year but never see a physician. So what if they're sitting in your chair and you know how to communicate some of the most widely accepted relationships of oral diseases and systemic health? What a gift that is for you. But more importantly, what a gift it could be for the person that hears the message that you share with them. And so it's crazy serious. And I can tell you 80% of disease could be significantly stamped out if we as dentists help people understand how to moderate certain lifestyle issues or correct and stabilize certain issues like periodontal disease and airway management and airway issues. That's it. So what do we do in our practice? We put up placards. I mean, we have a whole campaign. It's called Health Measurables That Matter. And all of our Wellness Dentistry Network members have access to this. And these are big pieces that we share, and we rotate these with patients. And I want to go through a few of them just to maybe jog your thinking about certain things that we could do in practice that would be amazing. So here we go. Gum disease is really critical. You know, that's one of the big ones. And so what I'm looking at as I'm talking a little bit about the entity, just read the words on the screen that are questions that you could ask a patient. And if you said, yeah, I'm asking all those questions now, good for you. But maybe if you're not asking all those questions, think about, why could I ask them? Why should I ask them? Because you know, it's the bugs that live around the teeth that we can measure now using salivary diagnostics. That's what this is about. We can measure using salivary diagnostics. And oh, by the way, when I started this in 2009, there were like 2 companies. Now there's probably 10, 12 bacteria testing companies that provide great information for us about the biofilm. or the microbiome in the mouth that's affected by mouth breathing, dry mouth, periodontal disease, other things like that. And what do we know about biofilm? It's not just bacteria. It's yeast and viruses that make up the biofilm that contribute to the disease process. How many therapists, periodontal therapists on the webinar who will hear my message are treating for yeast right now or viruses before they treat for bacteria? It's really critical. So we ask these questions because these questions are critical. And then what do? We try to explain the inflammation that we see around the gums to the patient using the papilla bleeding index. And how do we do this? And this is how we calibrate our hygiene teams. So they help the patients understand it and they get it. And patients hear it and feel it. That's what this is about, because we like to show them what's happening in their mouth. And then what are the companies that we use that test for? What do they tell us? They help teach us how the bug population in someone's mouth, if they have high-risk pathogens and a slew of moderate-risk pathogens, how that can affect cancer, cardiovascular health, rheumatic arthritis, which we'd call joint and muscle health, dementia and brain health, metabolic health, and even what happens to the woman that's pregnant and trying to nurture a baby and bring a small child into the world, and how could that make a difference for them, both from a microbiome standpoint, and obviously you're interested in the sleep piece. And we have new tests that are coming out that have more robust panels where they cover bacteria, yeast, and even viruses. I'm treating several cytomegalovirus cases now and Epstein-Barr cases. And these viruses need different treatment. And I have 40% of my periodontally diseased patients have yeast as part of the infection. So when you have patients that don't respond to traditional therapy, start asking questions. Maybe I'm not looking at the right thing. Maybe I'm not looking at the microbiome at all. It's a great opportunity for us in practice, and we've been doing it for years. Now, what about cavities? This is our second biofilm mediated infection. And what do we do with cavities? We know it's a complex process. It's a very complex process. And it takes a lot to explain to a patient what's happening when you have cavities. So we have a Health Measurables That Matter campaign about cavities. And we talk to patients about doing microbiome testing for cavities. And then how to create a strategy that's more than a fluoride treatment and a tube of toothpaste. And if that's all we're doing in practice and maybe some diet modification, there's so much more we could do. There's so much more we could do. Many childhood caries cases have a yeast component and they need yeast treatment, bacteria treatment, tooth mineralization, dietary modulation, different things that we have an opportunity to do. And you could do some of it, all of it, or you could do almost none of it and just go on and pretend it didn't matter. But if you want to cure the patient from a lifetime of restorations and crowns and root canals and failed root canals and implants, then maybe wellness dentistry is for you. Because if you could intercept it at 10 years old, that would be amazing. Because you could change the microbiome in somebody's mouth for their lifetime if you could teach them about it and know how to measure it. It's amazing. What about oral abnormalities? We all do this. We call it oral cancer screening. We're looking for any abnormal lumps or bumps. But we know the traditional risk factors for this are not what's causing the cancer today. I mean, who'd have thought it'd be HPV or oral sex or some relationship that you had 35 years ago? And now it's affecting your throat and your neck. And, you know, I have 4 professional colleagues that have had neck dissections. And it happens in men my age. And it's scary to think about it. And we didn't know what we were doing then. We didn't know the impact that it would have in our future life. But just like women do their self breast exams for lumps or abnormal lumps or bumps, men have to do the same thing with their neck because it's gotten to be a big deal today. Throat cancer from HPV, 22% increase. So it's a big deal. And then obviously this is your spot. This is your spot. This is breathing disordered sleep. This is sleep issues. And we know snoring. We know that mouth breathing. We know that there's just so much for us here. And really, I'm learning for you. And I would tell you, I was invited to be here tonight from an experience that I had at a sleep medicine course in New York. And it was really nice to interact with other professionals and to talk to them about things I'm interested in and to learn more about what you're interested in. So I appreciate your patience with me tonight, not doing in just a total airway program, but I hope this piece is impactful for you to think about. So our hygiene team's aware when we see these kind of clinical signs and symptoms, signs for sure, we know something's not right. And we start to go fishing. And we start to fish for what's wrong. And I have a pediatric orthodontist and an ENT and a myofunctional therapist, not all part of my office, but part of my team. And we have other specialists that help us, physicians, and that help us with sleep metrics and help us understand what is it that we're looking at that looks so abnormal. And you know how it is. Once you see it, you never unsee it. That's the beauty. So what about cardiovascular disease? Just a small piece about this. How do I know if I have it? Is it genetic? Is it just because I eat too much fat foods and I have lipids in my body? How do I see it? This is an amazing piece of wellness dentistry, and we have entire modules on cardiovascular disease detection, management, and what we do with this. And again, when you think about your vessel system, don't just think about your heart. Because what else do your blood vessels service? What about your brain? What about dementia, Alzheimer's, cognitive decline? It's a big deal. And if you think that you might not be having cognitive decline yourself, well, I can assure you, you're not going to escape it because you're going to be dealing with somebody that has cognitive decline. So the idea is learn how mouth infections can affect Alzheimer's disease, and don't let people walk out of your practice with mouth infections that are damaging the brain on a daily basis. And what are the root causes of some of the inflammation that damages our brain? Well, you might not know what you're looking at on the screen really well, but I can tell you this is Dale Bredesen's analogy of how there's holes in the roof. And if you have these holes in the roof, it's contributing to dementia. And some of these holes in the roof have specific names, like periodontal disease, like sleep apnea, like other conditions, insulin resistance, and it goes on and on. And so what happens in the Bale-Donine or Beat the Heart Attack gene book authors world, where they're trying to teach physicians about early detection of cardiovascular disease? They use a cartoon. It's the tree of atherosclerotic disease, which is the fruit, but the root of the tree or the trunk of the tree is inflammation. And what are the root causes of inflammation? Look at them: low vitamin D, obstructive sleep apnea, periodontal disease, endodontic disease, infectious diseases, gut dysbiosis. How many? 57 different root causes that we should think about and how to manage. And what do we get to do in dentistry? I actually went to bat for my wellness dentist and said, we deserve the right to know if the blood vessels are inflamed and if there's something we could do to help the patient breathe better, to help the patient have periodontal disease stability, to help the patient be rid of the microbiome dysbiosis that causes caries. We could stop some of these things from happening. What do all these things have? They have a vascular effect on our blood vessels, and you can measure it. There's biomarkers that you can measure. And so I measure these from time to time on patients that are interested, and I can track these numbers. And I can tell you that this is our Wellness Dentistry Network lab panel, and every single thing on this panel with treatment, sleep apnea treatment, periodontal disease treatment, caries treatment, we can show some improvement. What a gift for us in medicine and dentistry to be able to do this. Now, what if you just have an awareness about certain things you might see on your films? What about a Panorex where you see this small little maybe suggestion that there's a calcification in the carotid artery? What if you pursued that a little bit and this guy comes in for wisdom tooth evaluation and you see this and you send them somewhere and they do a scan of their arteries? Well, let me just tell you what they found out for this 28-year-old kid. He's a 28-year-old male, but his arteries acted like he was 51 already. And he already had 93% more disease than men his age. This is a young heart attack waiting to happen. And if you could be the hygienist or the myofunctional therapist or the dentist or the other health professional that finds this for this young man, what a gift. They don't see you as a tooth mechanic. They see you very differently, and that's rewarding, and it puts more joy in practice. What about hypertension? We have certain questions to ask. Instead of taking blood pressure in the office, which many of us do, I have patients fill out their own blood pressure medicine record at home. We teach them how to buy a cuff and what to do with that cuff. What a gift of education for a patient. They send the information to their physician and they work on hypertension. What about metabolics? There's a thing called metabolic syndrome, insulin resistance, a precursor to diabetes. And so these next three things are about metabolics. And if you look at the questions are like, how good is your engine running? Do you have, do you know your HDL? Do you know your HbA1c? Do you know your LDL? Do you know your blood pressure? Do you know your triglyceride level? Are you on cholesterol medications? Some very simple questions. And when you see these things chairside and you know your patients have these things, you know what? Maybe their engine's a little sluggish and they're not running so well. And they have what we call metabolic syndrome, very early stages of metabolic disorders. And then obviously we want everyone to be able to have a methodology of taking a patient's A1C. Why is this important? And this is what I would use in my practice right now. It's a 5-minute test. And I would do that because patient's A1C is a risk modifier for periodontal disease management. And you know, if people aren't sleeping well, it will affect their blood sugar as well. So that's why we want to know that. Insulin resistance is all of a sudden the next step to diabetes. When your insulin receptors aren't working well, you have too much free insulin in your bloodstream, you have too much free sugar in your bloodstream. And you know, when you have a lot of sugar or insulin in your bloodstream, and it shouldn't be there because it's not being processed properly because your receptors aren't working, it's like shards of glass cutting up the inside of your vessels. And you know what you get from it? A whole bunch of vascular inflammation. And it's a key piece. And your A1C will help you detect this, but you can look at patients and determine other things that will help you see, do they have this? And if they do, all you do is casually mention it to them and give them a referral. And maybe they can find out something that would be life-saving. And what about all the undiagnosed diabetics? 10% of your diabetic patients are undiagnosed. So what if you're the one that finds the A1C over 7.5 or 6.5? And the patient says, I didn't know. I haven't been to a doctor for 5 years. Or maybe I did feel like something was shifting in my metabolics, but I didn't get it. What a great opportunity for us to teach a patient how to monitor their own glucose. Or today, how to wear a continuous glucose monitor that you can punch into your arm and you can get the metrics on your phone. We do that for a lot of patients as well. What a nice opportunity. So a couple things and a couple tips. If any of you are having blood glucose issues, just read this book, Blood Sugar 101. Read the first couple chapters by Jenny Rule. What a great book. Go down and pick up a little glucose monitor and some test strips, or better yet, get a continuous glucose monitor and stick it in your arm. I think the Abbott company will do that for free for you now because it's such important information. Keep a record. Keep a record. I give you instructions here. You can go back and stop the video and read this and get a record and then teach your patients how to do this. It's amazing. You'll find many, many pre-diabetics and diabetics in your practice. How do we manage yeast? What do we do about that? Well, I didn't think about this, but yeast is a big part of our gut. Yeast is a big part of our mouth. It's a big part of our nose, but when it gets imbalanced, it can take over and it can really help bacteria grow in a way that I didn't think they would grow, in a much more aggressive, a much more antibiotic resistant, a much more antiseptic resistant biofilm. When yeast get involved with them. So what questions do we ask? Do you have chronic sinusitis? Do you have a frequent yeast infections or genital or rectal itching? Do you have sensitivities to foods or smells? Do you crave sugar? Do you have any allergies or asthma? And have you ever taken prescription antibiotics? When you answer yes to these, we know you might be at risk for yeast. And patients with periodontal disease have a lot of yeast. Well, it gives me the courage to ask the question about sinus infections. We have a good study that says out of a bunch of people, 37 million in the US have chronic sinusitis. But out of a bunch of people studied, if you have chronic sinusitis, 96% of those patients had yeast in the nose. So if I treat the mouth, I got to treat the nose, and I should treat the gut. Not hard to do. It's a simple, in 30 minutes, you can learn how to do that. And then what about hydration, disorientation, constipation, confusion, feeling of malaise, all from inappropriate hydration. So we want to help our patients take in half their body weight in ounces, the right kind of hydration in a day. What about nutrition? What kind of diet do you have? How do you describe your diet? We think the Mediterranean diet or pescatarian diet with some lots of vegetables and a little bit of fruit would be the same thing. But what about your patients who are gluten sensitive or dairy intolerant? We see a lot of that in the aging population. And what could we say to our patients that would really help them? And what about our 30-year-old athletes or 30-year-old people that are starting to transition into maybe midlife and they start to add on weight and they have their own metabolic challenges? What can we do for them? And would we want to introduce them to a product like Prolon where they take in fasting mimicking? Or maybe it's intermittent fasting, but methodologies of fasting. And what does it do if you get involved in caloric restriction? Could caloric restriction be good for you? Well, I can tell you that if you restrict calories strategically, you can change your body weight. You can change your body architecture. You can change your waist circumference. You can change your lipids. You can change your stem cell development. You can change C-reactive protein, cholesterol, blood pressure. It's incredible. And so this is a program that we use intermittently with detoxification. And it's easy. And what are the results? I did this on myself and I had 15 years of blood data. And my average total cholesterol before using the fasting mimicking product called Prolon was 175 in just 3 simple months of using it a week a month, and went down to 136. HSCRP over 10 plus years was 1.8. It went down to 0.3. And 5.6 was my average A1C. It went down to 5.5 in this time. And so again, amazing results in dietary management. And we can help patients. I have patients come in all the time and say, I want to pick up a case of Prolon and I want to know what can I do next. What about exercise? Moving your body is huge. This is a huge opportunity for us. You need about 150 minutes a week. You got to move your body. And when you do that, good things happen to your metabolics. Good things happen to a lot of your body. And what do we have today? Trackers, cool activity trackers. Almost everybody's wearing an Oura Ring, a Whoop strap, a Fitbit, some kind of Apple Watch, some kind of health tracking system. And it really helps us, but we want to encourage this in the practice. Lots of things you could do for that. What about coaching stress management for patients? Are there programs, things we could easily talk about if you're a hygienist, a therapist, or a myofunctional therapist? Could you mention how to breathe and how to manage stress, or maybe give the patient some literature about stress management? Makes a huge impact in their life. Stress management is critically important. And then what about supplementation? Do you know how many people are supplementing improperly? I had this one gal come into the practice and I said, she set this Tupperware container down on the bench in front of me and said on the countertop and said, these are my supplements. And I said, it was round, it wasn't too big, but it was pretty thick, full of pills. And I said, you take that every day? And she said, no, 3 times a day. And so the idea is some of these people who are seeing functional medicine doctors are taking all kinds of supplements. Do you really need that? Do you know how to measure what your body needs in macro and micronutrients? It's not hard. It's a $300 test. And you could find out if you need something, take it. If you don't need something, don't take it. Your body's not designed to need 3 Tupperware containers of pills to function every day. I can guarantee you that. And then what about the pollutants that we're exposed to? Electromagnetic frequency radiation, secondhand smoke, different things that we get in chemicals and products and our cosmetics, incredibly polluted, many of the cosmetics. And what do we think about when we're talking about pollutants? Well, we talk to our patients about pollutants because it's important. I want them to know about their living environment and what do they have going on there. And there's different environmental kits that you can get. By the way, the one I have on the screen is no longer available, but there are kits like this that you can buy at the home improvement center that measures mold and radon and lead and asbestos and formaldehyde. Some people are living in environments that are dangerous. I had one gal come into an appointment with me. She hung her purse on the coat hook next to the doorway, and I could see the way the light reflected on it. I could see the mold or the hyphae growing on the purse. And I said, where do you keep that purse? And she said, right next to my bed in a nightstand. I said, you need to check your house for mold. The assistant that was assisting me that day said, I think I might have a problem in my room too. And she pulled her bed away from the wall. Her bed's up in the corner of her apartment building. Mold all along the baseboard underneath the bed. If you're breathing that, you can have asthma. You could have elevated cardiovascular biomarkers. Huge opportunity just to know about the environment. And then this is hot on our radar right now. What about all the PFAS pollutants in Teflon coated products? I use a special Teflon now to cover the heads of my implants before I restore the patient because I don't want it to contain pollutants that could hurt the patient. This is important. And again, what about mold exposure? Any damp area. I live in the Northeast, Detroit, Michigan. We have rain, we have basements, we have leaking places. And then what about your workplace? If it's not your home, what about your workplace? You can go to Lowe's or Home Depot right now and get a small mold kit where you twist the cap off. You set it on your desk for an hour, put the cap back on and grow it and see what happens. You could be having many contaminants coming through the furnace system in your workplace or in your home. You want to test that so you could know. And we have in our network, we teach people how to measure all these things so they can figure it out. And what do we do this? Do we do it all at once? No way. We do this one at a time, slowly, and we build in lifestyle concepts that we can teach our patients slowly over time. We don't do this all at one time. It would be overwhelming for any of us. We learn it over time. All I'm doing tonight is giving you a small smattering of each of the areas where you could become incredibly proficient and help patients be successful. And this is a big one too, heavy metals. What about our amalgams? Did you know there was a test out that you could do for less than $200 that would tell you if the amalgam came from fish, or I'm sorry, if the mercury came from fish or came from an inorganic source like your amalgam? And when you have a patient comes to you and says, I want my amalgams out, I say, why? You don't like the way they look, or you don't like the way you feel? And if they say, I don't like the way I feel, then I would take out their amalgams. But before I did that, I would measure their amalgam load, how well they're clearing it, if they're accumulating it in their hair. And if they are, then I would take it out. And then I would retest them 6 months later and see how they're doing. This patient had a 95% reduction in inorganic mercury exposure just from taking out the amalgams and putting in resin-based restorations or ceramic-based restorations. What a gift for the patient. And this patient, and what a nice way to show the patient that you're doing it for the appropriate reasons. Why do I want to do that? Because you know every one of these teeth you cut apart could be sensitive, could break, could need a root canal, could mean more. I don't want them to tell me I caused that. I want them to know they wanted that. And then what about compounding in dentistry? This is a big area that's coming more for the future. There's a lot of compounding products in your midst, but you might not recognize that as being significant. And so compounding products are nice because they're made specifically for the patient, and they can be tailored to body weight, age, all kinds of things. But we use a lot of compounded products. Nystatin's compounded. Tray gels for your perio trays are compounded. Nasal sprays are compounded. Formulations for the mouth are compounded. Lots and lots of opportunities for us. So we want to learn about compounding in dentistry. It's really, really important. So when I think about wellness dentistry, oh, it's not about just detecting sleep apnea, periodontal disease, and tooth decay. There's a lot more we could do if we just know what to say and if we just know what to look for. And it's a great opportunity for us. And what I would like to do is help coach and guide any of you to go down this pathway. So there's three critical points, three really significant critical points about why this whole process in the wellness movement is so successful. It just so happens it's unique. Not many people are doing it. It's incredibly relevant because you can save someone's life. And it just so happens all the science that's coming out every 20 minutes says it's true. And what a gift for us to have that working on our behalf. So I want to thank you for your efforts and the work that you do to make you the best professional you can be. And you know, one of the things I'd like to think about for wellness dentistry is you have to be well. You can't take care of patients. You can't take care of your children. You can't take care of your families if you're not well. So you want to go in and learn these measurables about yourself. That's what we do at our COI Center course called the Wellness Week. We do all these measurements on you so you can learn about your health journey and where you are. And I can tell you, I find an immense amount of disease in 25-year-olds and 35-year-olds. What a gift if you can find that out when you're young, because then you can change it. And just what I said in the beginning, when you're healthy, you want a million things. You want a bigger boat, you want a different house, you want all kinds of things. But man, when you're laid up and you're sick, you just want one thing. You want to be well. So I hope that gives you an opportunity to learn a little bit more about what wellness dentistry is about. I would love to field some questions and maybe have Renata or someone on her team help me with that. And I really want to thank Airway Circle for inviting me to come and be part of your learning journey. And I hope that we can be a lot more beneficial to you in the future, and you can reach out to me at any time. So I appreciate that. So Renata, thank you for inviting me.
Oh my goodness, Dr. Thompson, thank you so much. This has been absolutely wonderful. We are a very multidisciplinary team over here. And, it's the only way that we can approach patients by looking at everything. I always say that we wear our goggles based on our specialty. And it is so important for us to work with other professionals who have different goggles. We're going to see things that we are not seeing at all. We have to work together. We have to work in collaboration. So thank you so much for coming into Airway Circle and sharing what you're doing with your patients. And can we please just change the name of dentistry to oral medicine?
No kidding. Yeah,
I
well,
mean, why?
it's funny, Renata, because someone told me when I rebranded my practice to Integrative Oral Medicine, they said, "Oh, that's a stupid name. They have no idea what you're doing." And I mean, I get that, but I can tell you when patients come in and they feel it and they see what we do, it's amazing. It's amazing. We've had patients do amazing things for us because they love what we're doing for them. And what a gift, because for me, it just expands my joy in practice. I walk into the practice every day. It's not even like working. I'm just having a ball trying to figure out who can I help today? Who am I going to what am I going to do today for somebody? What gift can I give someone today? And of course, they're always giving me gifts back. So it's just amazing. And
Oh, I
I want people to feel that.
absolutely. I absolutely love that. First of all, we are live on Facebook again. We have a grougroup of our 2,800 professionals there that get to see a little bit of the presentation. So tell us a little bit how to get in touch with you and how to take your course. Is it only through COIS?
No, it's not only through COIS. We have some online opportunities, but one of the ways you could see all the materials that I showed on the screen, that's our Wellness Dentistry Network. And if you
Okay.
go to wellnessdentistrynetwork.com, I believe we have a free trial membership. Our website was recently revamped and relaunched, and so we're working some bugs out like every new website has.
Yes.
So, have some patience. But I can tell you the big thing, Renata, is I really think that the most passionate healthcare providers that I've met are dental hygienists and myofunctional therapists. And it's not sometimes the dentist. Even though the dentist wants to lead it, it's hard for us to run it. So the idea is if you want to get involved, you get your doctor or your office to join the Wellness Dentistry Network. It's a small annual membership fee. It's not a big deal. And we will help guide you at your pace. And we want to start with periodontal medicine. We want to make sure you have a good sleep program. And then we want to push into some other areas that expand your thinking and your knowledge, where you can not only generate revenue, because Renata, one of the things I didn't mention, but I know you said you like to talk about cases. One of my biggest referral sources right now are physicians, and they send patients in because people are sick. Well, I'll tell you, those people have tremendous dental needs. I've had
Wow.
people come in and spend $60,000, $70,000 in the practice on restoring their mouths because they're sick. And I didn't want to make this about profit, because if you
Mm-hmm.
put health first, the profit piece will come. If you put health first, the profit piece will come. So that's the idea. And I think you guys put health first, and
100%.
that's what you do. And
Yeah,
it'll,
especially our colleagues always hanging out with us every Thursday night, always learning. We do this out of our heart.
wow.
It is definitely a business to own a clinical practice, but the question is always how many people are you serving? How are you serving them? We are called to serve, so that is huge. Anne had a question: can myofunctional therapy be considered part of a wellness dental practice?
Of course, of course, of course. I mean, yeah, when you think about the training that you're doing to get patients to use the anatomy and structure they have, there's no question, because anything that you can do, look at that little person. Anything that you can do to mine are 30 and 27 now, but I have 3 grandchildren like that. So it's unbelievable, because the what you can do to help somebody breathe better. You saw the picture that I showed after sleep apnea. Somebody had lip
Yeah.
incontinence. What if you could just teach them how to close their lips and put the tongue in the right place and how to swallow properly? I mean, of course, after you evaluate the anatomy and make sure the parts are all connected
Mm-hmm.
properly.
Yes,
But I
yes.
mean, it's huge. So yes, of course, the answer is undoubtedly yes.
I had a patient today that I saw, and as soon as they turned on the camera, I mean, I could see his tonsils from the side of the screen, and I'm sure he had huge adenoids too. But this little boy, the whole time,
Yeah.
mouth wide open, about 7, 8 years old. And the mom really just did not know, are his tonsils really a problem? We just went to the ENT. They want to take him out. And they're big. She said the first time I saw them, he was a baby still. And I took him to the doctor and I was like, oh my goodness, why his tonsils so big? She said, I thought he was sick. And the ENT just said, no, that's normal. Yeah, that's just
It's
normal.
not
It's
normal.
his tonsils. That's what his
Yeah.
tonsils look like.
Yeah. Well, what about
Um,
the people who videotape their kids snoring and they think it's funny? I
Oh
mean, it's
gosh,
nothing.
yes. I have a few of those videos to share. But I asked them, one of the things that I asked them, it was about mold. And they were like, oh yeah, we actually have mold in the bathroom. And I was like, all right,
That's
rule number
a,
one.
that's a huge deal. Yeah, mold's a huge deal. And I didn't realize what mold does, but when you breathe in those mold spores, sometimes your body thinks it's yeast that sets up an inflammatory reaction, and you can have
Wow.
incredible asthma. You can have incredible systemic inflammation from that. And that puts people at risk. And there's a lot of older adults living in moldy places too. So it's really a big problem.
Oh my goodness. Does he have any benefits for periodontal health? And can he help those who have or at risk for periodontal disease? Just the whole wellness practice.
Oh, of course. Periodontal disease is one of the first things we look at. And again, periodontal disease was the thing that I started to work with, and I measured the bacteria profile of every patient that I treated for the last 15 years. And I've seen amazing results in what happens to the oral microbiome. And I know that through proper treatment, we can shift that. And if you shift the microbiome to one of disease to health, patients can keep it that way. Your mouth has an individual fingerprint, just like your thumb does. And if you fix it and get it stabilized and teach them how to manage their mouth, they'll keep it that way for years, and they'll just be nothing for periodontal maintenance. And if you have any periodontal therapists or hygienists listening on, or will listen in, you know there's nothing better in the world than a stable periodontal maintenance patient. You know, that patient's informed, they know what to do, they want your feedback, they know you're doing something valuable for them. I mean, how cool is that? So we want
100%.
a bunch of those people.
Tamara is saying hygiene would be so much better to work in an office like this.
Yeah,
Yes.
come on. Yeah, come on. Bloomfield Hills, Michigan. I need you. Crazy.
Do you guys incorporate the Lambert screening questionnaire into your practice?
Absolutely. It's one of our basic airway screening practices. You saw Steve's book, Treat the Cause, Treat the Airway. I first got introduced to airway very early on by Michael Gelb and the Gas book. And then obviously we've seen other Dr. Nestor and great people, and Tom Colquitt, and I was part of I've been part of PANI. And
he just sent me an email yesterday.
yeah, you know the group, right? And so we've had these people up to Detroit. We've had Audrey Yoon and Stanley Ewan to Detroit, and Kevin Boyd, and all. So yes, the airway management piece is critical, and it's a big part.
All right, last question. What diagnostic information can oral DNA tests provide? You mentioned a little bit already about it.
Yeah, they can provide a bacterial assay that will give you both the presence of certain pathogens and the quantity of those pathogens. But in addition, they have a beautiful yeast profile. So out of the same saliva sample, I mean, oral DNA can give you genetic information. They can give you information on yeast. They can give you information on bacteria. But let's simplify the conversation. For every active periodontal disease patient that I treat, I always order a pathogen profile. That's called MyPeriopath. And I always order a yeast profile, and that's called Oris Candida. And those are two nice tests that'll help you get going in periodontal disease management. If you want to learn how to do that, join the Wellness Dentistry Network. We have a ton of information in our perio module, videos. We do monthly webinars. We'd love to have you.
Thank you so much. We're going to post the link in our Area Circle Professionals group. If you guys are not in our Facebook group yet, please join us. Dr. Thompson, thank you so much. We really appreciate you spending your Thursday night with us.
Don't discount the koicenter.com. If people want to bring their hygiene teams to the Koi Center and learn a great course, we'd love to spend 2 days to talk about this stuff.
Go get it. And to let everybody know what we have going on, July 4th, we are taking the day off, so you guys enjoy your holiday next week. Yes. We have a new myofunctional therapy course coming out. It's called Foundations of Orofacial Myofunctional Therapy. It launches August 1st. It is going to be the most comprehensive myofunctional therapy course in the United States. It is 15 weeks long, and the girls are putting the links in the chat. We also have our podcast, Beauty of the Breathing, for you guys to listen in. And what else we have going on? And July, I think it's 11th. July 11th, we have a very special speaker, Sam Cabert. He is a breathing guy. He just did a TEDx not long ago. So I'm going to share the TEDx so you guys see who's coming in next on Every Circle. Thanks for everybody who shares what we're doing, who is in our directory, who are talking about airway circle to this new upcoming dentist in airway. Not only that, but any hygienist, speech pathologist, physical therapist who wants to learn more. Our webinars do make you a more well-rounded clinician. So join us every Thursday. We love you guys. Thank you so much. Have a wonderful night. Thank you, Dr. Thompson.
Good night.
We appreciate you. Bye, everybody.
Thank you. Bye.